So let's get started. I'm going to share my screen. So we're going to be talking about brain disorders. So let's get started. I'm going to be talking about brain disorders today. And hopefully there's some of you guys are familiar with some brain disorders that we talk about today. I tried to talk about 3 common ones, and then one which is very rare. And I hope you guys find it interesting. So the table of contents today, we're just going to going through introductions of what are brain disorders, the different types of brain disorders. Then we'll touch up on the biopsychosocial model, and then we'll get into some of the major disorders like major depressive disorder, schizophrenia, Alzheimer's disease, and then here's one which I found which was very cool. I think alien hand syndrome. And then after that, we'll touch up on some treatment options, and then we'll call it a day from there. So, what are brain disorders? Um, Brain disorders, it's a very, very complex topic, a very diverse topic. So, this is the best definition I could find. Any ailment that alters the structure or function of the brain and causes a variety of physical, mental, and emotional symptoms is referred to as a brain disorder. Many factors can cause these conditions, such as illnesses, trauma, genetic abnormalities, and chemical imbalances. Now, one thing about this definition is it's very biological focused. And what I mean by that is it's talking about uh, neurotransmitter imbalances, um malfunctions with brain organs, and these are biological definitions. In terms of brain disorders, their causes can be very vast. Sometimes what happens is a person may possess a condition, but there is no biological evidence, as in there's nothing wrong with the brain, there's nothing wrong with the neurotransmitters, and these can be seen through brain scannings, which are called fMRIs and MRIs. So magnetic resonance imaging and functional magnetic resonance imaging, and these allow us to detect um, different brain organs, how they're functioning, as well as how the blood is circulating through these organs when different parts of the brain are activated. So, through various techniques, we can actually um, scan the brain and analyze different areas. But again, that's all biological. Let's say we scan something and we don't find any sort of malfunction, but there is a condition in the person. Then what do we do? Then the the biological aspect is kind of leading us astray. We need to look at some of the different other things like psychological aspect and the social aspect of different things. I'll get back to this, but I wanted to touch up on the biopsychosocial model, and this is something that I learned recently as well in my psychology classes. So the biopsychosocial model, it basically um, focuses on the biological, social, and the psychological factors which can lead to a brain disorder. So as I mentioned, sometimes we have brain scanning, um, brain images which are perfectly fine, right? Perfectly normal. We don't see anything, but a person has an underlying brain condition. So that means that the biological aspect is gone. That we can focus on the psychological and social aspects, right? And that's what this framework allows us to do. Like, look at the person. How is the person doing psychologically, right? How is their physical health, their coping skills, social skills, family relationships, and the same thing with social. Their social part of their life, right? Their relationships and etc. So that's what this biopsychosocial model it does. It allows us to look at all aspects of the person's life and determine something from there. Do you guys have can you guys think of anything that goes into any of these sections? So biological basically is all like tangible solid evidence like brain scans as I mentioned and stuff like that. And then psychological is more it's the external factors in the person's life. Yes, the meeting will be recorded. The meeting is being recorded right now. Yeah. Uh, we'll get back to questions later, to be honest, because this meeting is not going to be too long. So we'll just focus on some of the content. So, as I mentioned, brain disorders are very diverse. They're very vast. Here, these are some of them which I found: neurodegenerative disorders, psychiatric disorders, cerebrovascular disorders, and there's a lot of them. There's a lot of type of disorders, and in these categories, a lot of different disorders fall under these categories, and some of them we'll be talking about today, hopefully. Can you guys all hear me? Everything's good in terms of hearing?
Yeah.
Okay, perfect. So we'll get started with major depressive disorder, MDD. So does anybody know anything about major depressive disorder? Just out of curiosity, like it's mentioned a lot, um, but some people might not know about it, and some people might um say something like, "Oh, I have depression," which is called over pathologizing, basically meaning that we're sad for some certain amount of time or something like that, but we don't meet the entire criteria for depression. But it's just a saying. But I just wanted to ask: does anybody know anything about major depressive disorder?
I
You
think
can.
it's when you're always drained and you lose interest for every aspect of your life. Is that right?
Yes, yes, that's a very good explanation. It's a very critical part of major depressive disorder. So,
Mhm. That's
uh,
all I know, unfortunately.
that's okay. That's okay. We're all here to learn. And as I mentioned, I don't know if some of you were here last time. As I mentioned, I'm also a student. So I'm also always learning. And these disorders, I'm just getting exposed to these disorders right now as well. So we're all learning together. So major depressive disorder is one of the most common mood disorders, and it's more than just feeling sad, right, for a few days. So for a diagnosis, a person has to experience symptoms for at least 2 weeks, and these symptoms need to represent a real change from how they normally function. And so we're talking about, as you mentioned, persistent sadness, feeling down, and a loss of interest in things they used to enjoy. And this is called anhedonia, a loss of interest and motivation in things. And they often lack energy, and they're tired. A lot of times they're tired. Uh, and People might also have feelings of guilt or worthlessness, changes in appetite and sleep patterns, and in some cases, suicidal thoughts, right? And then when you look at the causes of major depressive disorder, it's not just one single factor, as mentioned before. Biologically, we know that there's brain chemicals which are so there's imbalances in brain chemicals, right? Like for example, there's serotonin, and then genetically, some people are also more vulnerable to depression because it can run in their families. Like if their parents have had depression during some time in their life, um, or um, potentially their relatives, then it could also be genetic, right? And that increases the chances of them, of the person we're talking about, getting depression. Um, so on the psychological side, there's trauma and chronic stress, and these are very big contributors to major depressive disorder. And then there's also social factors, as you mentioned, like there's isolation. Isolation is a big one, right? If someone is always alone all the time, there's no sort of support for them. Um, and Sometimes it can get hard to cope with things, especially when you're alone. So these social factors can make the symptoms worse. And then MDD typically starts in the late teens or early adulthood. And if it's not treated, it can affect someone's ability to work, study, maintain relationships, and even take care of themselves. So that's how severe uh, the depression can get. And there's two different types of depression. There's major depressive disorder and there's persistent depressive disorder. Major depressive disorder, the symptoms are a lot worse, I would say. But in persistent depressive disorder, the symptoms are also present. right? They're also affecting daily life. Now, if I were to ask you guys, let's say a patient came and they possessed all the symptoms for depression, and they said that they've been feeling depressed for the past 5 days. Would we consider that as major depressive disorder?
No, because it has to be at least 2 weeks. And I have a
Perfect.
question.
Yes.
Could depression be connected to ADHD, for example? Or are those two completely different ones? Could ADHD also be genetic and also be caused by depression?
Um, to be honest, you're gonna have to research that because from what I know, I don't think ADHD and depression are connected per se, but depression is comorbid with many different. When I say comorbid, it basically means that it's present with many other disorders at once. But I'm actually unsure about what you asked, so I think it's best for you to research that, especially because we have a lot of AI tools, so it's very easy, and it's actually a very good question. I've never thought of that before. ADHD is a completely different type of disorder. Yeah, it is also a brain disorder. Um, so there could be some sort of correlation, but I'm unsure about it. So that's a very good question. I think I recommend you look that up whenever you have some time. And
Okay, I
yeah,
will for sure. Yeah, thank you.
thank you for your question. Yeah, I've actually I'm also a camp counselor, and I also deal with uh kids who have ADHD because it is also sometimes genetic. Uh, and like so it's something interesting because I have there's someone I teach them table tennis, and he's extremely smart and he's gifted, but I couldn't really understand him first few times because he when we used to speak for the first few weeks, he used to interrupt me a lot, and he used to the I thought it was just attitude, or it was just the nature of the person, but eventually he told me that he has ADHD, which made me think twice about everything. And I started speaking to him about the things that he enjoyed. I started talking to him about it, and then he would listen to me, and then he would tell me about it, and I would listen to him. I would tell, and it's very interesting how these disorders work, and it's very cool, I think. And it was something to learn. It was definitely something to take away. Yeah, that's just what I had to say about ADHD. So next one is schizophrenia. So schizophrenia is one of the most serious mental disorders, and it fundamentally changes how someone experiences reality. For a diagnosis, symptoms need to last for at least 6 months, with at least 1 month of active symptoms like hallucinations, delusions, or disorganized speech. So these are big in schizophrenia. Hallucinations can involve hearing voices or seeing things that aren't there, and delusions are strong false beliefs. That's the difference. Hallucinations are their voices or things that are not there, but you hear them or you see them. While delusions are strong and false beliefs that you have, right? And these beliefs that don't change even when there's evidence against them. For example, believing someone is out to get them when that's not the case. So these are false beliefs that someone has in terms of in schizophrenia. And then alongside these symptoms, there are also other symptoms like lack of emotional expression, reduced speech, and social withdrawal. Cognitive symptoms like trouble focusing or remembering information are also common. And schizophrenia typically appears in late adolescence to early adulthood, sorry, with men often showing symptoms earlier than women from the research I did. But yeah. Now, the causes of schizophrenia can be complex and very diverse. Uh, Biologically, we see a dysregulation in the dopamine system, the brain, but there's also strong evidence for genetic vulnerability. Again, if someone in their family had schizophrenia, it increases it increases, it makes someone else more vulnerable to schizophrenia, right? And it could also be related to prenatal complications and social factors such as growing up in a high stress environment, right? These types of things, because again, cognitive development when we're younger, when we're in our childhood, our experiences, they shape our life, even though we might not think much about it, but they actually shape a huge part of our life. So if we grow up in these high stress environments where we're constantly in stress, constantly in some sort of risky situation, then that the effects will be visible when we grow older. Alzheimer's disease is the next one.
Questions. Sorry.
No,
Sorry
no,
to
no, no
interrupt you.
problem.
I have a question
No
about
problem.
schizophrenia. It's a trend on TikTok to be delusional. And what is delusional? What are delusions? Could you explain to me in short?
For sure, yeah.
What are and your dreams and something that you dream of? I think it's misinterpreted.
Right. So delusions can be of many types, but essentially what a delusion is, it's like a false belief that someone has. Like I'll give you an example. So for instance, let's say you're watching TV and there's a cartoon character, and essentially you're watching that TV and you think that cartoon character is trying to give you a message. He's trying to tell you something. Now, um think about it like that, right? So you're watching TV and the cartoon character is trying to give you a message. In reality, that's not the case. But for in turn, when a person has a delusion, that's what he strongly believes, that this character is giving me a message, like they're trying to tell me something. And then when someone tells them like, hey, no, it's just like um cartoon, it's not that serious. He's gonna say things like, no, he's actually giving you a message. And that's called, I from what I remember, it's called referential delusion, but I could be wrong. But so it's essentially a false belief that someone has. Does that make a little bit more sense?
Yeah, so superstitions could also be delusions. For example, whenever a person sees on the calendar that 13th of the month is Friday, they freak out because of the superstitions. Could that also be a delusion? Because some people put a lot of meaning behind those things.
Um. So you're saying that a person freaks out when they, like, in that example?
Yeah.
Um. So it depends on what the person thinks about the situation. So if he's having a false belief that um something's gonna go wrong, something's gonna go crazy, then it could be a delusion. But for the most part, um they're pretty separate. If you understand what I'm trying to say.
Yeah, I understand. It could be also cultural background could play a huge role
Yeah,
whenever. Yeah. Thank you for an interesting answer.
yeah, no problem for sure. Let me just take a look at the chat. Yeah, I don't know if I gave you the best answer, to be honest, but superstitions, they're usually like sometimes they might be through culture, right? As you mentioned, um, and it could be through different things. Uh, Delusions, on the other hand, they're like firm, strong beliefs that something's gonna happen, like this is definitely happening. For example, if someone wakes up one day and he thinks that he is the savior of the world, this is called grandiose delusion. He thinks that he's a savior of the world, or he's here to save humanity, this that. This is called a grandiose delusion. So it's a firm belief which is false, essentially. You know what I mean? But yeah.
Yeah, I understand.
Okay, let's go to the next one. So we have Alzheimer's disease. Alzheimer's disease is the most common cause of dementia, and it's a neurodegenerative disorder, meaning it gets worse every single time. So the early stages, there in the early stages there might be like mild forgetfulness, you know, but eventually it affects personality and behavior, and people may lose the ability to even care for themselves. So the typical age of onset is after 65, but there's also like early onset for Alzheimer's, which can appear in people as young as 40s and 50s. Now, at the biological level, Alzheimer's is linked to the buildup of abnormal proteins in the brain, and these essentially they disrupt the communication between brain cells and eventually lead to the cell's death, like in the brains. And then genetics can also play a role in Alzheimer's. Now, what makes Alzheimer's particularly challenging is that it doesn't just affect memory, but it impacts judgment, mood, and relationships, and places a significant emotional physical burden on caregivers. So it's essentially the rational thinking, the judgment that we have, um, it starts to fade away with Alzheimer's, and yeah, that's the condition, and unfortunately, it's very sad. Sometimes people just change completely, they forget, and that's it's just the beauty of the creation, I guess. And then this is the last condition we're going to be talking about, and I found this to be very interesting, so I wanted to mention it. um this is called alien hand syndrome. Who's actually heard of this before? Anybody has heard of this before?
I haven't.
Sorry?
I haven't.
You
It's
haven't
so
heard it?
interesting.
Yeah,
Yeah.
I never heard of it before either.
Mhm.
So alien hand syndrome is a very rare neurological condition. um So people with this condition feel as if one of their hands has a mind of its own. So that hand might be reaching out and grabbing things without the person wanting to do it. Or it might perform actions that conflict with what the other hand is doing, essentially. And in some cases the other person can feel the movement happening, but they can't even stop it. And others, they may not even be aware of the condition. So the cause is usually damage to the brain, especially the corpus callosum, which connects the two hemispheres, the right and left hemisphere of the brain. And this damage might happen after a stroke, a brain injury, or certain types of brain surgery, like split brain surgery, done for like split brain surgery. I think they're done for like severe epilepsy. So, and what's interesting is that the movements, they're they're purposeful, right? They're not just moving. The hand isn't just twitching, it's actually just it's performing coordinated actions. So this makes it different from other movement disorders, and it gives neuroscientists insight into how motor control and awareness are like basically how they're linked to the brain. Yeah, this is something that I found was very cool, and I
Could
didn't know
it be
about this.
only one hand or both of them?
Pardon me.
Could it be one hand or both of the hands moving?
It's one hand, but I don't know actually if it can be both hands.
I think it could eventually cause something worse. It starts with your hand and goes on your whole body. Could be. What do you think?
I think it may be the case. Uh, it may actually be the case, but Now that I just looked it up, it's saying that alien hand syndrome can affect both hands. So it can affect both hands, which is pretty insane. That think about it, because yeah, and yeah, you're right about it being worse because it is damage to the brain, which is an essential part of our body, right? The brain is a control system of our body, so it can get worse potentially. I just got a notification that we have 10 minutes left for the meeting. So hopefully I can try to wrap it up. So next is just gonna be the treatment options that we have. There's psychotherapy, medications, and things like that we'll just talk about very briefly, and we'll wrap it up from there. Then, hopefully, I can get through everything. If you guys have any questions in between, then please don't hesitate to reach out. But if we don't finish, then we won't miss a lot. So let's get through it. So in terms of treatment, so for MDD, major depressive disorder, biological treatments include antidepressants like SSRIs, which are selective serotonin reuptake inhibitors, and there's also SNRIs and tricyclics. And if symptoms are severe and resistant to other treatments, options like electroconvulsive therapy or transcranial magnetic stimulation (TMS) can be used. So these are ways in which uh, the brain is shocked, and these essentially they're given when the depression is very it's stubborn. Like it's not the symptoms are not getting worse, right? The symptoms are stubborn and they're present. So that's when these options are used. There's also psychological therapies like cognitive behavioral therapy, and these are used to change the negative thought patterns in the brain. And there's also interpersonal therapy, which focuses on improving the relationships that one has with another person. And there's also behavioral activation, which encourages people to re-engage with meaningful activities. So the activities that they enjoyed, right? Re-engage with those to see how you feel. Um, get to schizophrenia. So with schizophrenia, the first line of treatment is usually antipsychotic medications, and they're either pills or they're injectables. And this is usually to reduce the hallucinations and delusions that a person has. Now, remember, in schizophrenia, it's a condition where the hallucinations and delusions are very severe, right? And they really affect a person's emotional well-being, mental well-being, to the point where they're not even able to go to work, right? So it affects them in a severe manner. So that's why hallucinations and delusions are focused on in terms of treatment, and there might be hospitalization needed. And there's also, again, as mentioned, there's cognitive behavioral therapy for psychosis, and there's family therapy, which reduces relapse by improving communication and social skills. um, and so essentially it's like basically training which helps people function and integrate into the community. The patients of schizophrenia helps them come back to the community basically. There's Alzheimer's disease. For Alzheimer's disease, it's unfortunate, but there's no cure for the disease, but we can slow it down and improve quality of life for the patient. There's certain inhibitors and other medications which help with memory and cognition. Um, Cognitive stimulation therapy keeps the mind active. Reminiscence therapy uses personal memories to boost the mood. And also, family support and education are essential for managing the daily care of the patient. And it's essentially how we can kind of mitigate the situation, the disease, to improve their life, the patient's life. And then at the end we have the alien hand syndrome, and coping with brain disorders often means building a strong support system and finding strategies that work for each individual. So what this means essentially is that essentially we had the individual has to find something which helps them cope with it. So this might include like regular therapy sessions, following certain medication plans which are given to the patient, and also joining peer support groups. And it's also important as um, it's important to have open end conversations and allow yourself to open up, right? Because from time to time, everybody goes through something, and it's important to have open end conversations and really open up to the person. Um, I had one thing prepared for this. So for coping mechanisms, I wrote this down. So coping with brain disorders often means like building a strong support system and finding strategies that work for each individual, right? As mentioned before, and this might include regular therapy sessions and following medication plans, as mentioned before. I think I may have skipped this. We have 3 minutes left. Let me just mention this real quick. So for alien hand syndrome, there's no standard medication for alien hand syndrome, but in some cases, there may be some injections which can reduce the involuntary movements, right? And psychological and occupational strategies, there's those are also used in terms of coping with this condition. These include keeping the affected hand occupied with an object, using mirror therapy or sensory cues to increase the awareness, right? So when it's occupied with something, then it's it seems that it is better for the entire situation overall. And then the coping mechanism, this is what I was reading the whole time. That was my mistake. So coping with brain disorders, right? It means we should try and build a strong support system and find strategies that work for each individual, essentially for coping strategies. And again, this might include regular therapy sessions, following medication plans, and joining peer support groups, and also learning self-care routines, right? It's also important that we educate ourselves, um, even if it's not about the condition or whatnot. Education in general it's something that keeps us busy, and it's something that we should be doing, right? Um, and it's also important that we promote open conversations and reduce the stigma, so people feel safe reaching out to help, right? Helping one another is essential. That's how the entire human community works, helping one another essentially. So that's what I had for today in terms of brain disorders. This will be recorded, but I just realized that only this part will be recorded, like these corners. Hopefully that won't be that big of an issue because all the writing should be in it. But that's what I had planned out for today. Wasn't much. It was a pretty quick presentation, but it will be recorded. Hopefully you guys take something out of this. Um, if you guys have any questions, we do have 1 minute until the meeting ends. Otherwise, you guys are good to go. And yeah, it was great having you guys again. Hopefully, I don't know either when my next presentation will be or the next time we might do a project, but you guys will get an update on that. Are there any questions? Anybody have any questions?
I don't have no questions. I really want to thank you.
Thank you so much, Kiso. If nobody has any questions, then we can stop right here, and you guys are good to go. Thank you so much for participating. Um, Yeah, thank you, Miriam. Thank you as well. Thank you a lot for participating, and hopefully, we'll see you guys next time. Take care, everybody.